Welcome to Exam Sale. In this video we will break down the test prep syllabus for the American Academy of Cosmetic Dentistry accreditation exam and explain exactly what you need to learn. The exam is divided into 4 domains with explicit weights: clinical science 45%, dental science 25%, laboratory science 20%, and accreditation criteria 10%. Each domain includes a stated focus, difficulty level, estimated learning time, and a conceptual plus scenario-based assessment approach. Clinical science carries 45% of the exam, is rated hard, has an estimated learning time of 55 hours, and is assessed with conceptual and scenario-based questions. This domain focuses on restorative techniques, adhesive dentistry, and material application. You will master adhesion and bonding systems, including etching and conditioning protocols for enamel and dentin, hybrid layer formation and resin tag mechanics, classification of bonding agents from 4th to 8th generation, management of dentinal tubule fluid and postoperative sensitivity, solvent evaporation and air thinning techniques, and bonding to non-tooth substrates such as ceramic and metal. You will also learn restorative material application in depth, covering composite resin chemistry and filler load properties, polychromatic layering techniques for natural aesthetics, light polymerization physics and factor management, preparation designs for direct and indirect restorations, finishing and polishing protocols for surface luster, and management of proximal contacts and anatomical contours. Dental science represents 25% of the exam, is rated medium, carries an estimated 35 hours of study time, and uses both conceptual and scenario-based assessment. This domain covers biological foundations, dental anatomy, and smile design principles. You will study detailed anatomy of maxillary and mandibular anterior teeth, primary, secondary and tertiary surface morphology, line angle placement and developmental lobe characteristics, embrasure form and proximal contact area relationships, morphological variations related to age and gender, and root anatomy with periodontal attachment considerations. The aesthetic smile design portion addresses facial and dental midline analysis and alignment, incisal edge position and phonetic relationships, gingival architecture and biological width, principles like the golden proportion and tooth dimensions, occlusal concepts such as anterior guidance and interference, and smile arc dynamics including buccal corridor management. Laboratory science makes up 20% of the exam, is rated medium, has an estimated 20 hours of study time, and is assessed conceptually and with scenarios. The focus is on material science and clinical laboratory communication. You will learn ceramic systems and laboratory coordination, including classification of dental ceramics into glass-based versus crystalline types, material selection for CAD/CAM and pressed fabrication, and shade matching science covering value, hue and chroma. You will also master laboratory prescription requirements and photographic guides, surface treatment of ceramics for cementation and bonding, and diagnostic wax-up fabrication with clinical matrix utilization. Accreditation criteria account for 10% of the exam, are rated medium, require about 10 hours of study, and use conceptual and scenario-based assessment. This domain teaches standards for case submission and clinical evaluation and guides how to prepare cases for accreditation. You will learn classification and requirements for case types I through V, the AACD standard photographic series and documentation expectations, evaluation criteria for margin integrity and placement, assessment of surface texture, luster and characterization, radiographic evidence standards for submission, and criteria for internal and external line angle symmetry. Altogether the syllabus sums to about 120 hours of recommended study and demands both deep conceptual knowledge and practical scenario skills. Prioritize clinical science first, then reinforce dental science and laboratory science, and finish by mastering accreditation criteria to submit compliant, high-quality cases. Use the AACD syllabus references during study and create a study plan to cover each specific topic before attempting the exam.